Happy Friday, everybody, and welcome to everyone's favorite show about plastic surgery, health, and beauty. This is Nip Talk. On today's show, first off, we're going to be talking about the process of mummification. Sarah's been dying for me to talk about this, and it's going to happen today. Then, Jackie O's cause of death has been released. We're going to discuss that. And finally, we're going to go over a case I did with a severe dog bite injury to the lip. That's all coming up right now.
Live from Lincoln Center in the heart of the Dallas Metroplex, this is Nip Talk. An honest and uncensored show about plastic surgery, health, beauty, and lifestyle with your host, plastic surgeon Dr. Bruce Hermann, and your co-host, entrepreneur and social media influencer Sarah Bennett. Now it's time to discuss the good, the bad, and the ugly of the topics everyone is talking about. It's time for Nip Talk.
Welcome back, everybody. Thank you guys so much for joining us. We really do appreciate it. Please hit that like and subscribe button. It helps us so much. And leave us a comment. We want to hear from you. I'm your host, plastic surgeon Dr. Bruce Hermann. With me always is the wonderful Sarah. Looking
Hi.
great today. How are you, Sarah?
I'm good.
Travis, how you doing in there, buddy, in the box? Everything good?
I'm great. How about you?
Everything's great, man. It's Friday. It's good times. Good times.
Absolutely.
So we don't have a ton of time for our intro stuff, but I'm going to the Texas OU football game tomorrow. And
Nice. I went to one before.
Have you been to it?
A long time ago. When
It's
I
been a
was,
while.
like, in
I've
high
been
school.
to a few over the years. Yeah. Travis, you ever been to Texas OU?
I've been to the fair during Texas OU weekend, but I went to Grambling and Prairie View's football game last Friday. So
Oh, did you? How was that?
I was
Who
at
won?
the Cotton Bowl. Grambling
Did
actually
they?
won.
Was it a good game or was?
Yeah, it was pretty good.
Was
It wasn't
it?
too bad.
Yeah, Texas and OU were both really ranked high this year, and they're both undefeated. So should be a pretty great game.
It should
Yeah.
be really good.
Yeah, I'm pretty excited about it. I didn't go to either of those schools, but just I really like college football, and it's right here, and it's like fun to see a game.
Are you going to get like a funnel cake or a turkey leg when you go?
I'm going to eat a corn dog. That's like my one guilty pleasure at the fair. I like those jalapeno cheese corn dogs, the
That
Fletcher's
sounds
ones.
good.
Oh, they are good. I'm sure
I love corn dogs.
I'm not going to eat for like 2 days afterwards to make up for it. I love those corn dogs. All right, so I want to start rolling into our segments. So Sarah, the other day I don't know how we got on the topic of
It's
mummies.
because of those aliens. And
Because of the aliens, right. And we talked about they look like mummies, and then we started talking about, how is mummification done? And
Yeah.
so I am actually going to talk all about mummification today. Now, did you guys know how about this process? I mean, I knew a little bit. I feel like I did learn something when I was doing the research for this.
I did, but I like mythology and stuff. Like all of that, like Egyptian.
Right, so you're like
mythology
all
and
into
stuff.
that?
Not into it, but it's like interesting.
It's interesting.
But,
So
yeah.
you've like read about it before? Mm-hmm. Yeah, so I knew I knew a little bit about the whole process of mummification. I can't say I was an expert. I do definitely know more now. So this dates back for like 3,500 years. I mean, this is a very, very old process, and it was something that the Egyptians, as well as some other cultures, did to prepare themselves for the afterlife. And the whole process was done by these Egyptian priests, which were basically modern day embalmers, is what they were. Mm-hmm. And this process took like a long time. Like it was 50 to 70 days in order for them to. Yeah, I was kind of surprised. I didn't realize.
Interesting.
Yeah,
I bet only like fancy people got it though.
That's exactly right. So it was very expensive at the time to go through the process of mummification. And then of course, you had to have a place to put your mummy or your sarcophagus. And so yes, it was definitely reserved for their royalty and the nobles and all of that. So the process was pretty in-depth. So what they did, the first thing after the person passed away, is they went to what's called an Ibu, so that's IBU. And this is the tent where they did the purification of the body.
Okay.
And so they would wash the body really well with this palm wine and these sweet herbs and spices, and then they would use water from the Nile River, because that was considered sacred water. Mm-hmm. So after they did that step, then they took them to another place, which was called the Wabbit, which is more like a modern day morgue. So it's just like a stone building, it's where the dead bodies were. And this is where they started to actually go into the actual process. So as you guys probably know, right? Like that they remove the organs. Have you heard that before? Yeah. So that was like a big part of this process. And you always hear about how they used. Did you guys ever hear how they would take the brains out, right through the nose?
Yeah.
Using a brain hook. I think Travis, I have a picture of those brain hooks. You got Yeah, so I mean, I don't know if those are original ones. That's from one of the archaeological web pages I found. And those are the hooks that these embalmers would use to remove the brain. And they wanted to do it without disrupting the skull or the face. And so they would actually do it through the nose.
Yeah.
And so they would put those up through the nose. And then there's a little thin bone called the ethmoid bone, which is really at the base of the skull. And they would punch that through into the brain, into the skull cavity. And then they would pull the brain out. Now, I'm really kind of curious how they accomplished that, because I've actually worked with
bits and pieces, I guess.
Well, I mean, I've worked with brain tissue. It's not really that soft. Like it has some consistency to it. So I'm not sure.
Maybe they do it like, maybe whenever, I don't know. Like maybe it like takes a little bit for it to like.
I was just thinking logistically how they would get it all out of there. I mean, because it's not like you just hook it and you pull it out. Like it's just not going to come out in one piece. I mean, you'd have to like pull it out in pieces.
Yeah,
and then how do you get to the back of the skull? I mean, I'm not sure I believe that they got the brain tissue out of every person entirely, just kind of knowing what I know. But what was really interesting though when I was doing the research is the reason they took the brain out is they didn't think it was important. Yeah, isn't that odd? They didn't think that the brain was an important organ. Which, I mean, it seems very counterintuitive to us in this day and age. But they just threw it away because they wanted to save the important organs, but they just took the brain out and tossed it in the trash, which I found very, very interesting.
Yeah.
Right? Yeah, it's crazy. So they actually thought that the heart was the most important organ, and I think that they thought that's where like the soul came from. So they would remove all of the organs, the body organs, through an incision they made in the abdomen, minus the heart. They left that in place. They felt like that the person would need that in the afterlife. But they did feel like the organ should go along with them. So have you ever heard of the canopic? I think I pronounced canopic, C-A-N-O-P-I-C.
Like
jars.
The little jars.
Yeah, the jars. We got a picture there. Just show that. Yeah, so there they are. And there was generally 4 of them, and these are the sons of Horus. And there was the jackal. That's the one on the left. Then you've got the falcon, then the baboon, and then the human. And those held the stomach, lung, liver, and the intestines. So each of those went into one of those jars. But they prepped them first. They dried them out, like almost they mummified the organs as well. And then they put those in the jars, and then they would be stored with the body. So once they got all the brain out and all the organs out, then they were getting on to the preservation part, right? Because they want to preserve the body. And they were correct in that the organs would start to break down and would cause a problem if you left them in. So they used a naturally drying salt called natron. I'd never heard of this. It's a salt that's apparently very prevalent in Egypt and Africa. And what they would do is they would stuff the inside of the body with that natron, and then they would cover the body entirely in this salt. And what it would do is it would pull all the moisture out of the body, because they wanted the body to dry out so that it would be preserved, which
like
is
a rice bag for a human.
Yeah, exactly. Yeah, you're pulling all the water out of it, right? And so they left him covered in this product for 40 to 70 days. So that's a long time. After that 40 to 70 days, they'd come back, they'd take off the natron, and the body would be all kind of shriveled and dark, but it would be really, really dry, which means it was more preserved. But then they wanted it to look good, so they would go back and then stuff the body with linen, straw, sawdust. Sometimes they would actually put stuff under the skin to kind of plump it back out. So even though that it was kind of desiccated and dried out for preservation, they would then kind of remake it into a more natural look. The eyes, I don't know if they took out the eyes. I couldn't figure if the eyes just came out or they rotted, but they would actually replace those with either quartz, stone, or oddly enough, onions. Yeah, I know, right? It's like, where did they come up with that? Onions. So finally, then the last step they would do is they would coat the skin in a resin. So they dried everything out, they got it looking good. They would take a resin and they would put all over the skin, which would just kind of make a nice protective covering. And then came the part where we all think about mummies, right? You think about the Halloween mummy with all the linen wraps. Then they would do the wrapping, and that was apparently a very detailed process. It said that it took about 100 yards of linen to wrap one body. That's a lot of linen. So
I guess you're probably going to get to this, but what was the purpose of them doing this? Just to make sure that they looked good for the afterlife?
Yeah, I think so. They were preserving, they wanted the bodies to last for eternity, I guess. And so
I guess they did.
Yeah, I mean, there's mummies that are thousands of years old. Like if the body dries out and you prepare it properly, I mean, it'll last for a very long time.
Yeah.
And so, I mean, you have to give it up to them. Like their scientific knowledge of how to preserve a body was actually, very, very intelligent. So they would wrap them in the linen, and then they would, put jewelry on them. Sometimes it would be a mask, like the one Tutankhamun had, and then they would put them in their sarcophagus, which is just a different word for a coffin, and then they would do the whole burial ritual, which is a whole other thing. It was a ritual to them actually going to the burial site and being sealed up and everything. But yeah, pretty crazy stuff that for people that were several thousand years ago to have that knowledge of how to properly preserve something in a manner that still is around today that you can see.
Yeah.
So pretty wild stuff. I was going to ask you guys, do you believe in the mummy's curses?
I mean, I really love those movies, The Mummy.
Yeah, right. I do. The Mummy movies are great.
Those are
so
some
would
of
you
my
go
favorite
explore?
ones.
So say you happen to be in Egypt and they found like a fresh tomb. Would you be the first one to go in?
Yeah.
Yeah, Travis, you can explore the mummy's tomb.
I certainly would not.
You wouldn't?
I would not.
Oh, okay. I would.
I definitely would not.
I think I would.
We do have a viewer, Yasmin Collab 12. She said mummy curses aren't real.
They're not real?
She said bruh too at the end of it. They're not real. That's what they said.
Okay, very good. I don't think they're real either. In fact, they actually did some research on the curse of King Tut, and they found that it was not real.
What's the curse of King Tut?
Well, when they opened up King Tut's tomb, a lot of people associated with that died or had bad things happen to them. And so they actually did scientific studies to see if statistically these people had worse outcomes than average, and they really didn't. So they determined that the mummy's curse is probably not true. They thought maybe there was some pathogen that they put a virus or a bacteria in the tomb, but it was not true. It's kind of cool to think that, but yeah, not true. So mummies, did you feel good? You feel like you know how to make a mummy now?
I feel creeped out that they would even do that. You know what I'm saying?
Yeah, I know.
I just feel like
it's kind of cool though. Because it's part of history that
I know. I even think it's weird, our version of that.
Yeah.
When you go to a funeral.
I think more
home.
people are getting cremated these days, but
yeah, I think it's just crazy that people
go through a process.
Yeah, and then they have the open
yeah.
casket and then all of that.
It's wild. All right, well, if you have any questions about mummies, please leave them. I'd love to hear your thoughts on the mummification process. But now everyone, I guess, can go out and make their own mummies. Thanks for watching the show, right?
Yeah.
Sarah's
I'm I question eating salt now.
Right. All right, moving on. So we got a follow-up segment, okay? Do you guys remember in May when we talked about Jacky O?
Yeah.
She's the girl that was on Wild 'N Out, which is on MTV and E, I think. And it was very tragic. She's a mother of 3. She died after cosmetic surgery in May. And she had traveled from her home to Miami to see a plastic surgeon there, Dr.
Florida.
Oka. Yeah, Florida, man. And so we did a segment about her, but at the time we did the segment, it was very, very fresh. It had just happened. We didn't really know anything about the details. And a lot of it was just kind of speculation, and we were trying to figure out, we didn't even know what surgery she had, but I actually did have a theory about that. And Travis, I want you to roll. This is a video from that segment that we did back in May. I mean, honestly, if I had to guess, and I don't know this at all for sure, but it probably was a BBL, and there is a stated risk of death from BBL from fat embolus, meaning when you're injecting the fat back in, it gets in your bloodstream, which is a lethal scenario.
Yeah.
And that's if you had to guess on what happened. So I was guessing that maybe she had a BBL and maybe she died of fat embolism. So we have some more information now. She did actually have a Brazilian butt lift. That was the surgery she had. She had a lot of liposuction, and then they did a Brazilian butt lift, which, as you know, is where they inject the fat into the buttocks. And so this is per the police reports and some of the articles that came out since we've done that episode. Mm-hmm. So she reported having a really bad headache later in that day and falling into the next day, and apparently it just got worse and worse. And then as the day went on, she just said that her head was just burning, and she started to then have difficulty speaking. She was trying to speak, almost
She like meningitis?
like she was. No, it wasn't meningitis. That's a good guess. But she had difficulty speaking, like she was having a stroke.
Yeah.
And then she became unresponsive, and I think it was her aunt that was there with her, called 911, and then they took her to the hospital, and unfortunately they weren't able to resuscitate her, and she did pass away. So the autopsy report wasn't out in its entirety. This was kind of interesting. So the news from the autopsy report actually came from the Miami-Dade Police Department, because I think that they were looking in to see if there was going to be any criminal charges about this, which is really odd. I don't know why that they would assume that there was a criminal charge here, towards the doctor. I mean, unfortunately, there are risks associated with surgery, and people do sometimes pass away. So the Miami-Dade Police Department came out and said that the death was ruled accidental, and that she died from complications of plastic surgery. And a little bit more specifically, but not super specifically, they said that she had 1, swelling of the brain, and 2, that she had bleeding in the skin around the torso. So pretty clear from that that she did actually have a fat embolism from the Brazilian butt lift. And the reason I say that, a little information about fat embolism. So for people who don't know that term, fat embolism is when a fleck of fat gets into your bloodstream, and that can be a little bit or a lot. You see it in like orthopedic injuries where people have like long bone fractures of the femur, or sometimes orthopedic surgeries where they're working with the bones. The other surgery that unfortunately does carry a risk of that is Brazilian butt lift, because in a Brazilian butt lift, you're harvesting fat and then injecting it into the butt. And there are some big blood vessels in the buttocks, and that's why there's a risk of that. I do some fat injections for the breast, but the blood vessels are much smaller, and it's much less likely that fat can get into your bloodstream.
Okay.
When the fat gets into your bloodstream, it can do a couple things. One, it can actually block the blood vessels. So that would be similar to having a stroke if it went to your brain. The big symptoms of a fat embolism: headache, dyspnea, which is difficulty breathing, agitation, change in mental status, so that would be things like not being able to speak, coma. And then the other one that's kind of known for fat embolism is called a petechial rash, which is where you get these almost like blood streaks on your skin, commonly around the torso. So when they were describing that bleeding in the torso, I take that to be that it was probably petechial rash, which is kind of the hallmark of fat embolism. So
That's
I mean,
scary.
they didn't come out and say fat embolism, but the swelling of the brain would be from like little flecks of fat causing a stroke, embolic into the brain, and then it caused the brain to swell, and then she couldn't speak, and then passed out. So I think at this point you can safely say that without seeing the full autopsy. You can't say 100%, but I mean, it all fits together that she had a surgery which carries a risk of this. The time frame fits. Most fat embolisms occur 24 to 72 hours after injury, so that was like 24 hours. So everything kind of fits into place as to what happened to her. And it's really a sad thing. It's obviously an elective surgery, and I think with these surgeries, especially Brazilian butt lift, you have to think really hard about it. We've talked about these in the past, and how the risk of death from a Brazilian butt lift is 1,000 times higher than your regular cosmetic surgeries, and for this reason exactly. I mean, this is the one, and I think she's the most high-profile person that I know of that's had it happen to her. So it'll be interesting to see. With the last week when we were talking about most popular plastic surgeries, we saw that Brazilian butt lift was kind of static from year to year, and you wonder if things like this will make people less interested in getting it.
I hope so, but I honestly think that it's going, like, from the statistics that we saw, it's definitely going away from that body type. Like people,
you're right. I mean, we have seen that. We've been doing the show long enough. We're starting to see different trends in plastic surgery, and I do agree with you that kind of Kardashian look is not quite as popular as it used to be. So.
Yeah, it's more natural. Is the vibe.
Really sad though. I mean, it's a tragic story, and once again, we don't talk about things to sensationalize them, but to learn from them and educate people on what the risks are when you have surgery.
Yeah.
And
it's been a very graphic show today.
I know, right? Well, it's going to get worse. It's going to get worse. It's going to get worse with our final segment. We are actually going to talk about a case that I did about a month ago. And this girl, super, super nice girl, she was bitten by her dog. So this is a case study of a dog bite injury to the lip. That's my dog, by the way. I took that picture the other day.
I was like that. Yeah, I was like that. Definitely looks like your dog.
That's my little dog. Well, she's not little, but so this was a case of a dog bite injury to the lip. And so as a plastic surgeon, I kind of see the worst of the dog bites, because most people, if they get bit by a dog, they might have a couple puncture holes, a little cut, the ER will sew them up. I never see them. So I only kind of see the worst of the worst.
Yeah, the ones that like require
really,
some
really
reconstruction.
bad.
Yeah.
And so this one definitely fell into that category, and it was her own dog. She startled it, and it just kind of snapped really quick, and it got her really good. So I'm just kind of trigger warning here. These aren't like horribly graphic photos, but this is an injury, so if that's not your thing, then you might turn away from this. So, all right, Charles, let's see that first picture, all right? All right, so we're looking at the lip here, obviously. And the ER was kind enough to sew up that one laceration there right in the center, but the spot I'm looking at is that spot on the left ear frame. And you can see that there's basically a wound where the lip was. And this is a really challenging injury because it goes across what we call the vermilion border, which is that natural line of the lip between your skin and your lip tissue. And there's actually a lot of it missing, which makes it to where you can't just stitch it up. Like, you have to get really kind of creative to close this. Go to that next picture, Travis. So here's a little bit better picture of it. You can see that there is a pretty nice piece of the lip missing.
Chunk. Yeah.
Yeah, and it actually goes into the normal skin. So this is a pretty challenging one. I see a lot of injuries to the lip where maybe the tissue is not missing, and I just have to close it up right to make it look good. But for this one, I have to actually do some actual reconstruction type flaps to make this look right. So roll to your next picture. I think the next slide. So the first thing I did is I made 2 incisions, which I kind of signify with those white lines. I made incisions along the vermilion border of the lip part that was remaining. And so my plan for this is I was going to cut these pieces of lip and free them up so I could bring them together in the middle. So I made those cuts first, and then the next one, Travis, go to that next picture. So then I took out that part that was jagged. So where that teared skin got up into her normal skin, I just kind of rounded it out to make it smooth so it didn't have like a jigsaw type pattern to it.
Right.
So after that, then I had to actually make the flap. So hit that next picture. So I made incisions here, but I didn't go straight down. I made incisions and then started going in directions towards the left and the right. And what I was doing is I was actually taking the more superficial part of the lip and separating it from the deeper, like muscular parts in an effort to kind of pull them together. So show that next picture, Travis. So that shows the direction. So once I made those cuts, both on the surface and then on the inside, I was able to kind of pull that lip. And those lip tissues have a fair amount of stretch to them. So unless you're missing like the entire side of the lip, you'd be really surprised how much you can actually move that tissue. And then if you're skilled at doing suture, you can actually close these up and get a really respectable result. So Travis, roll on to the next picture. All right, so this is right after surgery. That was her in the post-op, and it's not the greatest picture because it's kind of looking down, but you can see in general the lip shape is restored. There's a little bit of tightness there right in the center, but that's okay because these tissues will stretch. So I was pretty satisfied with how that looked right after her surgery. She's definitely one that I thought at the time might need revisions down the road, but I was pretty happy I was able to accomplish. I was kind of high-fiving myself a little bit. But so I saw her back and I took out her stitchers, and then she just came back this week, and I have her a picture at 30 days. So that's her at 30 days.
Wow.
Yeah, so the shape, so the first thing to notice is the shape of the vermilion border, which is that demarcation between the red of the lip and the skin. Good, and it is, like, it's very distinct. There's no jagged tears to it. The surface of the lip actually looks very normal. The only thing that you can tell in this picture that she's had something done is the area right above the vermilion border on her right, which would be the left side of this picture. The skin is not perfectly white and clear like it is on her other side. And that's because of these dog bites, when they grab, it's not like a knife cutting, it's like it tears. And so it injured the very superficial part of the skin. And of course, that scabbed up, and it took some time for that to heal, and the skin discoloration. Yep. So those lines right there are actually where her incisions are, which you can't see them because the incisions on the top part are actually the border of the lip. And then as you guys probably realize, there are natural lines that go vertically in the lip, so that vertical line where I brought those two pieces together and sutured them is not really visible either.
Yeah.
So for 30 days out, like, I am super happy with how that looks. I really don't think that she's going to need any further reconstruction of this at all.
Yeah, it looks pretty good.
Yeah,
It looks
actually
really
came out
awesome.
Really good. Yeah.
Yeah, I'm super
Do
happy
you think
with that.
the discoloration will go away
Yes.
after a little bit? Yeah.
Yeah, definitely. So I think that, you know,
She's lucky.
yeah,
She's lucky you happened upon it.
I mean, I have to say I was pretty happy with that because, you know, the thing about plastic surgery when you have wounds like this is there's no textbook answer.
Yeah.
I mean, there's a lot of things you can do to fix these problems. And so each one of these is like a new puzzle. And of course, you end up using the same tips and tricks, you know,
Yeah.
from one to the other. But each one really is a new challenge. And so, you know, there's no textbook answer. You use your knowledge to create something to make, you know, the normal look come back.
Right.
And yeah, I was super stoked, and she was so nice. I really want to thank her for allowing me to use her story. She was kind enough to let me do that. But I just thought it's kind of cool to see. I mean, you know, it's a bad injury, and it's one that, you know, thanks to plastic surgery, you can have an injury like that, and, you know, a month or two down the road, you're completely back to normal. Which,
Yeah.
you know, in the past, where they just sewed that up, it would look totally terrible. And
Yeah.
you know,
It is interesting to see like the process, or
Yeah.
like how it kind of goes, because you see lip injuries and things like that, and you like, how is that person going to like get that lip,
Yeah.
that part of their lip back? Like, how is that
Yeah.
going to be fixed?
Did you do a lot of cleft palate reconstruction stuff?
I did when I was in training.
Did that help you do this? one?
Yes, it does.
Yeah.
Yeah, for sure. I mean, honestly, what helps me the most is just you do a ton of dog bites as a plastic surgeon.
Yeah.
I mean, I do these lip injuries very commonly. That one was pretty tricky because there was so much missing. A lot of times it's just like a little cut or maybe a tiny piece, and you're really just kind of suturing it back together, but doing it so it make it look nice. But that one was like a full-on kind of reconstruction of the lip. So I thought that might
Yeah.
be a cool one to share. But
It's pretty cool.
yeah, good stuff. So, all right, well, I think that's all the time we have for this week. Please leave us a comment. Let us know what you want us to talk about. Hit that like and subscribe button. It does help us, and we'll see you next week on Nip Talk.